Hi, my name is Stan.
My name is Connie.
My name is Judy.
My name is Aileen, and I'm a caregiver to my mother.
And I care for my mother, Octavia.
And I'm a caregiver for my mother.
And I'm a caregiver to my husband, Art.
I'm a caregiver for my wife, Ann, who's 72 years old.
Basically, I've done everything for providing for both of them.
I take care of my mother on the weekends. I take her grocery shopping.
Not only household chores,
I provide her medical care, coordination, driving, errands.
choosing meals, making meals, cleaning up.
I find that I take care of anything that he can't take care of.
Sometimes I find balancing time a real challenge.
The difficult part for me is taking me into consideration.
Balancing her needs with the needs of my family, the needs of my marriage, and my own needs.
Staying calm, nice, and positive.
The real challenge is, of course, the distance and the moment you get that last phone call.
What I love most about taking care of her is knowing that we're providing a secure and comfortable home for her.
It's the time we spend together.
Is the adventure of finding out new things all the time to trying to help him stay out of pain.
My name is Ed. I'm a spouse and I'm a caregiver.
My name is Colette. I'm a daughter and a caregiver.
I'm a caregiver, and I'm a daughter.
And I'm a wife and a caregiver.
I'm a daughter and a caregiver.
I'm a son, a nephew, and a caregiver.
Hi, my name is Deborah Day, and I help manage United Way Caregivers Coalition. While caring for a loved one has its special rewards, it's a very challenging job. It can be stressful, overwhelming, and sometimes lonely. Each caregiving situation is unique, but all caregivers share the need for information and support. And that's where the Caregivers Coalition comes in. We help caregivers receive the support they need to take care of their loved ones and to take care of themselves. Caregivers who lead healthy, productive lives will be better caregivers. The most important thing to remember is that as a caregiver, you're not alone.
It's a pleasure for me to introduce both people because Frank Quadrino and I knew each other a number of years ago when I was at an adult medical day center, and he came with his collection of people and talked about veterans benefits. So at that time it was interesting to hear what was available to veterans, and that's of course not as well known, which is why these discussions are so important. And Etta Nappi is just an incredible resource, works for VITAS Hospice. Thank you, VITAS Hospice, and does a wonderful job of informing people of the benefits available to veterans, and is just in general just an incredibly interesting woman who does a lot in the community. So thank you both, and I turn it over to you.
Good evening, everybody. As Ruth said, my name is Frank Quadrino. I'm the Community Outreach Manager for the VA New Jersey Healthcare System. And first and foremost, let me thank Ruth United Way for having both Etta and I here this evening to speak to you today regarding VA benefits. Before we get started, though, I want to know a little bit about you. Where are veterans? Raise your hand. Where are the vets? Okay. Well, first and foremost, let me take this opportunity, gentlemen, to thank you for your service to this country. Yes. Yeah. You know, when I was reading in the Star Ledger around Memorial Day, when my dad served in World War II, something like 25 to 30% of the total population served back then. That's really high when you think of it, because you know you had to be in between certain ages. Anybody want to take a guess what the total population that serves right now? 1%. It's 1% of the total population basically serves right now. So again, we certainly thank you for your service and dedication to this country. Now, I'm here tonight, but mostly to talk about what we call VHA, Veterans Healthcare, okay? The VA actually has three subgroups. VHA, Veterans Health Administration, that's where I'm from. Then you have the VBA, Veterans Benefits Administration. Those are the type of benefits that veterans may be entitled to, life insurance policy, going back to school, home loans, things of that nature. okay? And then there's the third category, that's the cemetery division, but we are not going to talk about that tonight, okay? So let me just tell you a little bit about VHA, okay? Because what you're going to find out, it's unfortunate that the VA is a very, very comprehensive healthcare, but it's very confusing, and unfortunately not every veteran is eligible for healthcare through the VA. Okay, so let me just go over some basic eligibility requirements. Prior to 1980, anybody who went into the service prior to 1980, if you did 1 day active duty, got an honorable discharge, you were eligible for VA healthcare benefits. Most people didn't know that. Nobody told you. I know when my father came back, he said basically he got a handshake and was told, you know, just go home and go on with your life. Nowadays, we don't do that. The folks coming back from Iraq and Afghanistan, they're given like 7 days of what they call a demo process where we actually brief them on what they're entitled to, okay? Anybody who served after September 8th of 1980, they really want you to do 2 years of active duty in order to be eligible for VA healthcare benefits. In addition, you do need an honorable discharge. There are 3 other discharges you can get and still be eligible for VA healthcare benefits. One is called a convenience of the government discharge. Basically, it means that, believe it or not, that your job in the service is no longer needed. So they sent you home early, okay? Hardship discharge, meaning that you had an emergency situation at home and you couldn't do your 2 years, you know, and they sent you home. And then there's what they call in line of duty discharge. Basically, it means you got hurt while you were in the service. Maybe you were a paratrooper and you were practicing your jumps one day, and one day it didn't go well for you at all, and you came down and you fractured both your legs and your pelvis and so on and so forth. There's no way you could continue. So they give you, it's called an in line of duty discharge. You would be eligible today to be you would be eligible for VA healthcare benefits today if you got that discharge, okay? Up until maybe about 15 years ago, very, very few veterans who were eligible were using the VA. A couple reasons. Number one, nobody told you that you were eligible. Number two, the information you were getting was incorrect. A lot of veterans said that, well, I can't come to the VA because I didn't serve during wartime. You could have been at Fort Dix for 2 years and come to the VA. A lot of veterans said, well, I didn't see any action. I wasn't on the front line. You could have been a cook. You'd be eligible. A lot of veterans said, well, I'm not a service-connected veteran, meaning that they sustained an injury. Doesn't matter. You could have been a non-service connected veteran and used the VA for your health care. So a lot of veterans were not using the VA, maybe only about 5%. So about 15 years ago, every VA in the country, there's 153 VAs, by the way, in the country, started to do community outreach. And that's what this is. Coming here, telling people what your benefits are. Tomorrow I'll be down in Freehold, New Jersey, doing the same thing. Thursday I'm going to be in Totowa. Friday I'll be down at Brick. And Saturday I'm going to be down at Fort Dix. And what we do is we go out and we tell veterans or people who work with veterans or people who are relatives of veterans as to what you are entitled to, specifically in my area regarding health care. So we started to do this about 15 years ago. Now remember, every VA started to do this about 15 years ago. And lo and behold, after we did it for a year or two, guess what we found out? The number of veterans that started to come to the VA doubled. Why? Because now you knew what the real story was, that you were eligible for VA healthcare benefits. It's unfortunate because a lot of veterans did not take advantage of it, okay? So that was one criteria, was the 1 day of active duty prior to 1980. Then after September 8th, they changed it to 2 years of active duty in order to be eligible for VA healthcare benefits. And then, unfortunately, about 11 years ago, there was another change with VA healthcare eligibility. And this is the one, unfortunately, that probably knocks a number of veterans out of the box. Basically, what happened was when we started to recruit a lot more veterans coming to the VA, in our wildest dreams, we never thought so many more veterans would come. So, consequently, what would happen was we would recruit so many veterans, and you would all call up for your first appointment. And today is what, January 27th? We would say to you, how does June 1st sound for your first appointment? And you say, wait a minute, I have to wait 4 or 5 months for an initial appointment at the VA? I thought I was a special person. I was a veteran, you told me. And you're making me wait 5 months for an initial appointment. Well, what happened was when the President of the United States and the person in charge of the VA at the time, again, they never thought that so many more veterans would come to the VA, and you were waiting a long time, and we had no extra money to go hire more doctors, nurses, social workers, psychiatrists, bus drivers, what have you. So consequently, we were doing you a disservice. So as of January 13th of 2003, there was another major change regarding healthcare eligibility. And this is what it said. If you were not already enrolled in the VA healthcare system, okay, we were now going to ask you how much money you make. And if your income is above a certain threshold, you're not eligible to receive VA healthcare benefits. Now keep in mind, if you already enrolled prior to that date, you got grandfathered in. So if you were Michael Bloomberg, and if he were a veteran and he enrolled prior to 2003, guess what? He would still be in the VA healthcare system using it. Meanwhile, some people like yourself or other veterans out in your community who are making, $60, $70, $80,000, they're not eligible to use the VA healthcare system. Now, there are exceptions to that. There's a number of exceptions. Anybody in this room an XPOW? Anybody? XPOW is automatic. Doesn't matter what their income is, and I'm sure each and every one of you in this room would agree with me, XPOW deserves everything they get. Anybody in this room a Purple Heart recipient? No Purple Heart recipients? Anybody know a Purple Heart recipient? No? You do? Okay. Purple Heart recipient, the income threshold does not come into play for them. They are automatically eligible for VA healthcare. Either one of you two veterans, what they call a service-connected veteran, in other words, you sustain an injury or illness and you file a claim? No? Okay. So anybody know Service Connect? You do. Okay. If you're a service-connected veteran, if you know a service-connected veteran, basically for you folks who don't know that, it means they sustain an injury or an illness while they're on active duty, and while they got out, they filed a claim for that injury or illness, and basically we're taking responsibility that, the injury was caused while they were in the service. And then you get rated, and Etta will go into that a little bit later, but any service-connected veteran that you know, automatically eligible. Anybody in this room know Vietnam veterans? Not Vietnam era, but Vietnam boots on the ground. You do? Automatically eligible. Doesn't matter what your income is. And the reason for that is, it's unfortunate, because we know that you're going to come down with something related to Agent Orange sometime in your lifetime. Anybody know any Gulf War veterans? You do? Tell them to sign up for the VA. Doesn't matter what their income is also. Because now there are a lot of what they call, starting to see a lot of presumptive illnesses related to the Gulf War veterans. Anybody in this room know anybody who served in Iraq or Afghanistan? Anybody? Automatically eligible. Okay? So as you can see, there are a number of different categories where that income threshold does not come into play. It's unfortunate that usually the two groups that it does affect the most is usually the World War II veteran, like my father, and the Korean War veteran. Those seem to be the two groups that have been affected the most by it. But again, keep in mind, if you were enrolled prior to that date, you could be a multimillionaire, doesn't matter what your income is, you stay in the VA healthcare system. Okay, so that tells you a little bit about income, all right? A little bit about eligibility. So once you're in, a lot of folks say, okay, now I'm in the VA healthcare system. What do I do? Well, the first thing you want to do is you want to make an appointment with a primary care provider at the VA. You could do it either at East Orange, Lyons, or we have 9 clinics throughout the state of New Jersey. The reason why we started to build clinics, I'll be honest with you, it was about 25 years ago when the first one was built, 23 years ago to be exact, back 1991. We built the first one down in Brick, New Jersey. Why did we build the first one down in Brick, New Jersey? Well, back in 1990, the World War II veteran was in their mid-60s. They were retiring. They were living up in Bergen County. They couldn't afford the taxes up there. Where'd they all move? Brick, Toms River. So we lost a lot of our clients by going down to South Jersey. They were going to drive an hour and a half up to East Orange Alliance, and I don't blame them. So we built a clinic, a very, very large clinic down in Brick for our veterans who were living down in Ocean County to utilize it. And I could tell you right now, it gets used by a tremendous amount of veterans. And we've built 8 more since that time. Probably the closest one to you is there's one in Morris Plains. Is that close? Is that, yeah? It's on East Hanover Avenue. That's probably the closest one to this facility right now. So you make an appointment with a primary care provider, because in the VA, the primary care provider is basically the person who controls your healthcare system. Okay? You can't actually see a specialist at the VA unless you're being seen by a primary care provider. Let me tell you some of the benefits that you can get. and I'll see if this gentleman, I don't know if you've taken advantage of it. You have a primary care provider, sir? Okay. Have you gotten eyeglasses yet from the VA? Okay, you can get free eyeglasses from the VA. Has anybody told you that? Okay. Next time you see your primary care provider, tell them you want to see the VA optometrist, and they'll do a refraction, and the eyeglasses themselves will be free. And just to let you know, I've been with the VA a long time, 37 years. I can remember back in the day when I first started, any veteran who got eyeglasses from the VA, they all got those thick black rim Clark Kent glasses. No more. You're going to get something like what you have, nice frames. They do bifocals, trifocals. They will tint if it's medically indicated. They don't do contacts yet, okay? Some veterans get free hearing aids, okay? You didn't get any hearing aids yet from the VA. You did. You got the free hearing aids. Okay. And you're what is known as a non-service connected veteran, right? You don't have any injuries or illnesses, do you? Okay. It used to be, sir, just to let you know, we only gave free hearing aids to what we call service connected veterans, specifically veterans who were service connected for loss of hearing. So let's say if this veteran himself was, I don't know what your job was, it's called an MOS, by the way, for people in the service, but let's say if he was on a flight deck, an engine room, anywhere where there was loud noises, a lot of veterans, once they got out, their hearing started to deteriorate, and we encourage you to file a claim for loss of hearing. And that's how a lot of veterans got free hearing aids. But nowadays, we'll give free hearing aids to all of our veterans who we think they need them because they are not understanding our doctors. So if I'm the VA doctor and I say to you, take 2 of these a day, and you repeat back to me, you want me to take 32 of these a day? I know there's something wrong. You're not listening to me. So that's probably why you got them. But that's one of the better benefits that the VA has done the last 5 years. Not only service-connected veterans, but non-service-connected veterans now get the free hearing aids. And by the way, hopefully somebody told you this. If the batteries go, they will send away for the batteries for you free of charge. You know that. Okay, just want to make sure. Dental's the most difficult thing to get up at the VA. That I could tell you. You got to be like an XPOW, Purple Heart recipient, or something like that. Okay? Prescriptions. You get prescriptions from the VA, sir? No? Good for you. You're not on any prescriptions, or you just don't get them from the VA? Oh, that's fine. Okay, that's fine. A lot of our veterans come to the VA to get maybe 1 or 2 prescriptions, because all of our prescriptions are either $8 or $9 for a 30-day supply. But I will caution you, don't get over-the-counter. If you get involved in the VA healthcare system, do not get over-the-counter medications from the VA. Aspirin, vitamin B, vitamin C, folic acid. You know why? We're going to charge you either $8 or $9 for a 30-day supply. You get a bottle of aspirin, there's 100 aspirin, VA is going to charge you $27 for that. So you just tell the VA provider, I'm going to get that at Walgreens or whatever, or Costco, and they put it on the computer. Okay? Now, since you're the only one here that does go to the VA, you probably noticed this. Do you notice the providers putting everything into the computer when you're there? Okay. We actually are the pioneers when it comes to electronic medical records. We started doing electronic medical records 1997. Do you know there are some private hospitals and private doctors that still today do everything handwritten? We do it in the computer. And we do it for a couple reasons. Number one, once we started to do that, we noticed a lot of our errors started to decrease, or medical errors. And I don't mean to be rude or anything like that, but do you ever see the handwriting of doctors and pharmacists? I mean, it's very difficult to decipher their handwriting. But ever since everybody does everything in the computer, a number of our errors have diminished. Another good thing about the VA, sir, I don't know if you know this, it's portable. I just told you we have 155 VAs. If you move to Florida 2 or 3 years from now, you go to the back of this book, and hopefully everyone took this. In the back of the book will list every VA in the country, the address, the telephone number, and so on and so forth. So if you move to Florida, you're already enrolled in the VA healthcare system. You just show them you have a VA ID card, sir? Okay. And you could go to any VA in the country. So that's another good thing to have. One other thing I want to talk about, because I have about 3 minutes to go, and then I want to turn it over to Etta. In this brochure, this is our VA healthcare brochure, In the back of the book, it talks about long-term care benefits. We have things like respite care, home-based care, a home health aide, and some of those programs, if you need them, you just need to speak to your primary care provider about them. Now, I just want to caution you about something. We have a 240-bed nursing home. We call it Community Living Center up at Lions, VA. I don't know if anybody here has ever seen Lions, but I could tell you right now, nobody in this room would qualify for it. You either have to be an ex-POW, Purple Heart recipient, or at least 70% service-connected, which means that your injury while you were in the service was quite severe to be 70% service-connected. So what we tell people to do is you're going to have to check out the state-run nursing homes. There's one in Menlo Park, there's one up in Paramus, and there's one in Vineland, New Jersey. So I just want to make sure, because a lot of people say, you know what, when my dad gets to that age, I'm just going to call Lions and get him up to that nursing home up there. Very, very few people are entitled to our nursing home. The last thing I want to talk to you about, we have a Caregivers program. Hopefully some of you hopefully all of you took it. It looks just like this. But again, in order for you to be eligible for the VA Caregiver program, the veteran must be enrolled in the VA healthcare system, have a primary care provider, and be seen at least once a year by that primary care provider in order to be eligible for this program. Now, everything I just talked about, the prescriptions, the eyeglasses, the hearing aids, and so on and so forth, you can get those benefits, but you have to first get by the first step, and that is the application process. And unfortunately, if your income is above the threshold, then you're not eligible for any of the stuff I just mentioned. Okay? We were told to speak for 20 minutes. I want to hand it over to Etta. Write down your questions, and then after Etta is finished, if you have any questions regarding healthcare, I'll be more than happy to answer them. Okay? Etta?
Thank you, Frank. My name is Etta Nappi, and I'm the Veteran Liaison for VITAS Innovative Hospice Care. I do work for a hospice provider, but my main function is to work with veterans and families in the community. Because when a veteran comes on service for hospice, they're terminally ill. And if they haven't done the things that Frank just spoke about, it's very hard for a hospice provider to get them those veterans' benefits. We can give them hospice service. Any veteran can receive hospice services, end-of-life care, palliative care. However, there's so much more that they can receive. If I bring a veteran on service and they're already in the VA system, they've already filled out that 10 Easy form that Frank just showed you, and they've seen their primary care doctor in at least the last year or 6 months, all I have to do is pick up the phone, call the social worker at the VA, and I get 6 extra hours of home care for that veteran. No waiting list for hospice patients. There is a waiting list, unfortunately, for veterans that need home care that are not terminally ill, but there's no waiting list for someone that's on hospice. So, the task has become so much easier. But I have to tell you, that's not what happens. I gave you some handouts tonight, and one of the items I gave you is a military history checklist. I go out into the community and I speak to doctors, long-term care facilities, assisted living facilities, and I ask them to please ask every one of their patients, are you a veteran or the spouse of a veteran? And if the answer is yes, I ask them to please give them this checklist so they know when that person served. So they can also then connect them to benefits or service-connected diseases. I recommend that every one of you sit down and fill these out for anyone that you are taking care of that's a veteran, and find out, what happened, because I handed you a list of diseases for Agent Orange exposure. I reviewed 23 veterans that came on service at my program today. And out of those 23 veterans, 12 of them were eligible for aid and attendance. Now, aid and attendance is a benefit that any veteran that's disabled or over the age of 65 can receive if they need help at home. If they're paying someone to take care of them, to do their house cleaning, if they're have a home health aide in their home, and they can get that benefit for themselves and their spouse. Now, if the veteran's spouse needs help, and the veteran is more than 30% disabled, like not disabled by a service connection, just disabled, he can then get the benefit for his spouse. But you're talking about if a veteran and a spouse are approved for aid and attendance, that's over $2,000 a month that they can then use to pay someone to help them. But of course, it's income-based and asset-based. So there is a cap, and we usually say $40,000 for the veteran, $80,000 for the couple. But Frank can tell you it's not written in stone, so they're the figures we go with. And then you look at income. If you have a home health aide in your home, it can cost you $6,000 a month if they're 24 hours. How many people have $6,000 a month income? You know, even if you take your Social Security, your pension, your annuity, and all together, you're going to be cutting it pretty close. And you can subtract what it's costing you for your home health aide, your health insurance, your medications. If you're using adult briefs to take care of someone, that's all deducted from your income. But that's it. You can't deduct rent or utilities or anything like that. But if the aid and attendance isn't applied for, when someone comes on service, I had 12 veterans that came on service. It's too late for me to get them aid and attendance because the benefit dies with them. And they probably could have been receiving this benefit for the last several years. And they didn't get it because they never enrolled at the VA. And just because you're going to the VA and being seen, don't feel so assured that everything that you have coming to you is now, you're receiving, because you have hearing loss, correct, sir? Did anyone ask you what you did in the military and when the hearing loss occurred? There's a possibility that your hearing loss is service-connected. So you really need to fill out that checklist, think about what you did, when the hearing loss started, excuse me, and possibly look at a service connection claim. And a service connected for hearing loss, you may only be, when you start, if you started years ago, 10 or 20% connected. But you can always resubmit for another exam as the hearing loss worsens and your service connection goes up. Excuse me. Now, service-connected diseases, if you have hearing loss and you have another service-connected disease, you maybe have like 20% here and 20% for this other condition. That doesn't make you 40% connected. Okay, that may make you like 30% connected. But you also have to remember that what you receive monthly is based on whether it's just you alone or you and a spouse or you and a spouse and dependents. So it's very important to really think about what you did and what your health issues are and really look into them. I can tell you that I run into people in the community every day. Now, getting back to the 23 veterans I reviewed today, 5 of them are most likely definitely service-connected because they have presumptive diseases. They have Parkinson's disease, they have leukemia, and they have prostate cancer. They've never put a claim into the VA. They're terminally ill. 2 of them have spouses that can now still pursue that, but the other 3, that disability compensation dies with them. And they've been sick for several years, but I'm seeing them at end of life. I have 4 that are already service-connected. 3 have lung cancers from Agent Orange exposure, and 1 has a service connection disability. He was an amputee from World War II. Okay, but that's 4. And then I have 2 who have comorbidities. They have diabetes, and 1 has PTSD. And they have surviving spouses, but because it's a comorbidity and it's not going to be the cause of their death, that spouse receives no income once this veteran dies. So it's very, very important. The first thing we do when a veteran comes on service is find out if they're enrolled. And I've enrolled veterans at the last minute to get them extra home care hours, but there's a lot of paperwork. You know, it's like buying the insurance policy after the accident. And I have to tell you, if I'm taking care of a loved one and they're terminally ill, the last thing I want to have to do is fill out a 23-page application or a 15-page application or even a 6-page application, because you have to put your financials in. So you really want to take care of business before you need it. You know, you should never write a will when you're terminally ill. You should have that in place. These are the type of things that you do. Is everyone going to be approved? No. But nothing ventured, nothing gained. You have to take that chance. You have to take that chance. I have connected probably 13 veterans in the community. They weren't hospice patients. They're not ready for hospice care. But we have service connection claims going because I recognize that they were exposed. Now, we talked about Agent Orange. We talked about Vietnam. Frank talked about boots on the soil. Well, around April or March of last year, the VA issued a publication about Agent Orange. They started spraying Agent Orange in 1944. We have veterans that served during Korea that were exposed. We have veterans that never left. This was in the United States. We have veterans that never left American soil, and they have been exposed to Agent Orange. And they have diseases like Parkinson's disease and leukemia. ALS is covered no matter what you did. If you have ALS and you're a veteran, you have a service connection. They're not telling us why it's a service connection, but it's a service connection. So if you know anyone that's a veteran that has ALS, tell them to put in a claim. It's so, so important. So I always start when I meet a veteran. First, I look for service connections, and then I move on to the next step, which would be aid and attendance, or definitely the first 6 hours, extra hours of home care. And then, of course, as far as nursing homes, Frank explained to you that you have to be 70% connected to go into the VA-based CLC in Lyons. I recommend that any veteran that feels that a nursing home may be in their future, that they put the application in now. Get your application in. You know, you're aging, you're not feeling well. I mean, you're not going to put it in when you're a 40-year-old veteran, but, you know, as time ages, because it's going to take time for your name to go up the list. But what's good about it is once you go to the top of the list, you stay there. So they will call you and say, you know, you're number one on the list. We have a room available, and you can say, well, I'm not ready for the room just yet. But you may be ready in 6 months. And then you can call, and if there's a room available, you go right in, which to me is great. I mean, it's not like senior housing where they call you and tell you they have an apartment available and you say you don't want it. You lose. You have to start all over again. You go back to the bottom of the list. It's not like that in Paramus and in Menlo. Could that change? Of course it could. But right now, that's how it is. So, again, just like those veterans that got grandfathered in 2003 and prior, you want to do what you can do now and get grandfathered in. Okay. Now, there's so many Agent Orange presumptive diseases out there. I mentioned ALS. I mentioned Parkinson's disease, all of the leukemias, Hodgkin's disease. Prostate cancer is huge. And respiratory cancers. That was a new one that they added just recently. All respiratory cancers, esophageal cancer, any bronchial cancers, that's all covered if you've been exposed to Agent Orange. Now, and like I said, you need to at least put the claim in. And I believe Service Connections retroactive to application also. Now, if you know of a surviving spouse whose husband died from prostate cancer 10 years ago, but they were a Vietnam veteran, and you know that he was exposed, that claim can be put in. They're not going to go back, but they will go forward. I do know some widows that are now receiving pensions for spouses that died years ago. You know, the Vietnam veterans didn't just start now dying from presumptive diseases. They've been dying for years. So, you know, talk to your family members, talk to your friends. You know, really take a good hard look at who's out there. And you know, just give them the idea, because they do get misinformation. I'm sure they've been told, oh, that's not covered. There's veterans out there that put in for service-connected diseases and they were denied because at that time it wasn't an eligible illness, or you had to have your boots on the soil, which is the first thing. I called, and I probably shouldn't say this, but I called the VA 2 days after this press release, which was sent from the VA website, VA Health website, and I called the Agent Orange coordinators, and I said, I have a veteran that has Parkinson's disease, and he served at Fort Drum in New York, and I feel he was exposed. And she said, well, how could he have been exposed? Did his boots hit soil in Vietnam? I said, no, but his boots hit soil in Fort Drum. And I had to direct her to that press release because she didn't even know that this was happening. Now, this is the Agent Orange coordinator that sets up the exams for veterans. So what you have to keep in mind is just because one person told you no, or absolutely not, or you can't do that, ask another one. Because I myself, when I call the VA with a question, I'll call 4 or 5 people. I take the answer I like the best because I may get 4 or 5 different answers, you know. And it's because not everyone, they know their job, but they don't know the other person's job. You know, there's things Frank knows about benefits and the guy sitting next to him in the office doesn't know anything about them because it's not their job. You know, and that's, you really have to know who you're talking to. You really have to know if the person that you're asking this question to knows the answer. Everybody likes to help. Everybody likes to, you know, give you guidance, but they have to know what they're saying. So when you have questions like that, you want to go to someone like Frank. You want to go to someone like me that works with it every day. You want to speak to a veteran service officer or a state service officer, you know, about applications and the process, and if you need help filling out the applications. You don't want to go to your next door neighbor and say, help me fill out this application. Because I have to tell you, if you fill it out wrong, it's going to sit on a desk somewhere. You want to make sure your paperwork goes in correctly. But again, when a veteran comes on hospice services, they can get all the services that any hospice patient gets. But if they're connected in the VA system, they can get a lot more. And that's my point. And it just breaks my heart. I had a veteran come on service with end-stage prostate cancer. He had been sick for 7 years. He was self-employed. By the time he came on service with me, he had lost his business, lost his home, and filed bankruptcy. And he was totally service-connected because he served in Vietnam. So 7 years ago, that was already being honored as a service connection. And he never made the call. He never got any help. He does have a surviving spouse, and I was able to help her. But look at what they went through when there was no reason. And service connection is not income-based. And it's not, you know, people say, well, I don't want to put in for it, you know, because I have money. I can take care of myself. Well, you know, that money goes real quick when you have an illness, number one. Number two, if you had a job, if you were a plumber, and you were exposed to asbestos, you'd put in a claim if you had mesothelioma. Well, when you're a veteran and you were in the military, that was your job. This is your compensation for doing that job. You have a job-connected disease or illness. Okay, take the word service out of it. I don't want to take it away from the other guys. You're not taking it away from anyone. It's your benefit. You earned it. And your loved ones earned it. And all I can say is, you know, you really need to really look at it and start with that checklist, because that'll really get you started. And take my card, take Frank's card, call us up. We'll guide you. I can't fill the application out for you because it's personal financial information, you know, and there's regulations, but I can point you in the right direction and I can help you, you know what to do, or call someone that can help you with that. And if someone has told you that the VA has a 5-year clock, that's wrong. I hear that all the time. The VA is not Medicaid. So if you had a lot of money and you've gone through it, or you've given it to your kids and, you know, you bought a house with it, or you bought a boat or did whatever, they're not going to look at that. There's no look back. It's not like you're applying for Medicaid. So Don't worry about the 5-year clock. It doesn't exist.
I want to make sure you understand this too. We don't charge, the VA, we don't charge a premium. We're not like Blue Cross, Aetna, Medicare, where you're getting a quarterly bill. Am I right? So you're not getting a quarterly bill from the VA just because you're enrolled in the VA. There is no charge. That's number one. Number two, just to also let you know this, we're getting a lot of questions about the Affordable Care Act, Obamacare. If you're enrolled in the VA healthcare system, we meet the standards. You do not have to go get another plan if you don't want to. If you want to, that's fine. Many of our veterans have VA, TRICARE, Medicare, Blue Cross, but you don't have to. And the last thing I want to tell you about, you heard Etta and I talk a lot about service connection. Okay, a couple of things you should also know about if you were a service-connected veteran. Number one, I just told you, you're automatically eligible for VA care. Number two, any service-connected veteran, they don't pay for the visits at the VA.
Right.
Okay? And number three, you get a check every month, depending upon how severe your injury is. A 10%, and it's in increments of 10, anywhere from 0 to 100%. A 10% service-connected veteran gets $129 a month. That's tax-free, both statewide and federal. 50% service-connected veteran gets about $850, I think, a month. Okay? And once you hit 50% service-connected, everything at the VA for you is free. You do not pay a penny, even your non-service-connected meds. 100% service-connected veteran gets about $2,800, $2,900 a month. And if they're rated 100%, and if you own a home in the state of New Jersey, you do not pay real estate taxes.
And it could be more than $2,800 a month if there's
Right.
a spouse. That's just for a single veteran.
So that's why we tell you this, to please tell the people out there who are your veteran, maybe your brother, your uncle, your somebody that doesn't know what they are entitled to.
Her question is that her dad was a World War II veteran who died in 1997, but he has a surviving spouse. I mentioned before aid and attendance. That is money that can be used for home health aid. And as long as he was honorably discharged, served, if he served during World War II, he was definitely serving active wartime. He did not have to be overseas. He did not have to see combat. He just had to be in the military. She is eligible for aid and attendance. It has nothing to do with him being enrolled. Aid and attendance, you didn't have to be enrolled in the VA system. Aid and attendance is a benefit for anyone that's disabled, over the age of 65, in an assisted living facility or in a nursing home, or of course living at home and needs help. But once they walk into an assisted living facility or a nursing home, they're eligible. Okay, because you're going to be eating up. You're paying $9,000 a month for an assisted living facility. There's not too many people that aren't dipping into their savings to pay for that monthly fee. But she's definitely eligible for aid and attendance. And there is an application. You can go on the va.gov website and download the application for aid and attendance. If you need help with that application, I would suggest that you get in touch with your local state service officer or veteran service officer. You can find, did you leave that list for them, Frank?
Yeah, it's in the,
There's a listing of all of the state and veteran service officers, and you can have them help you. The question was, the veteran's alive and the spouse is alive, but there's been a divorce. Divorce ends the benefits for the spouse. They have to still be married.
The question is, if a veteran's 100% service-connected disabled, does that put them in a different, as you call, what did you say? What's the word you used? The better VA? Actually, we have priority groups. If you look in this brochure, 100% service-connected veteran, anybody who's 50% or higher is what they call priority group number 1. They go to the top of the list. Okay, and we have 8 different priority groups. 100% is priority group number 1.
The question was, can a 100% service-connected veteran get home care hours? And my answer is, any veteran that's in the system can get those hours. However, if they're not on hospice, there is a waiting list. Okay, but that doesn't mean that you don't want to get them on the waiting list. Again, you don't want to wait until the last minute You see someone starting to decline, make that call. And or bring them into the outpatient clinic or to the VA hospital for a visit with the primary care doctor. And hopefully the social worker will put the wheels in motion for you.
The question is, can I talk a little bit about behavioral health services at the VA office? I think we're one of the, I have to be honest with you, like I said, I've been with the VA 37 years, and I think we are one of the leaders when it comes to things like behavioral health, especially when I first started at the VA, we had all the World War II vets, and some of the Vietnam vets were starting to come in, having, mental health issues and so on and so forth. I mean, we have I don't know if have you been up to Lions VA at all, or no? A long time ago. Okay. It's changed. Okay. We have a behavioral health building now, believe it or not. It was built, I think, in 1998, so it's about 13, 14 years old. I mean, we have psychologists, psychiatrists, social workers, therapists. We have outpatient care programs, inpatient care programs. Some of the even outpatient programs, the veteran can come on a weekend or at night, depending upon, and we'll make that decision whether how severe we think the illness is, if we think that person needs to be in an inpatient program as opposed to an outpatient program. We have substance abuse program. We have a domiciliary, a place for homeless veterans. I think the VA is the leader when it comes to programs like that, to be very, very honest with you. Anybody know any female veterans? Anybody? Okay. I'm going to be very honest with you. We were horrible, the VA, in recognizing female veterans. 2 reasons. Number 1, we were horrible. Number 2, anybody want to take a guess what the percentage of veterans that served during Vietnam were females? 0.5%. So the VA looked at that and said, we don't need programs for female veterans. There's no female veterans out there. Anybody want to take a guess what the percentage of people serving today in Iraq and Afghanistan are females? 13, between 13 and 15%. By the year 2020, the VA estimates that the percentage will be 20% females that will be serving. So guess what the VA has done in every VA in the country? About 5 years ago, they have had, they now have a women's program manager. So if you're a female veteran, it's not a good old boys club anymore. You can go to the VA also. We'll assign you to the women's program manager. They have programs designed specifically for female veterans. All right, her question to me was her husband served, her husband served in the National Guard or the reserves, okay? VA healthcare, in order to get into VA healthcare, you have to serve active duty, okay? Active duty is different than National Guard and reserves. Or if you did serve in the National Guard and Reserve, the only way you would be eligible for VA healthcare is if your unit got called up for a federal conflict. That is why the people coming back from Iraq and Afghanistan, who, by the way, they're mostly Reserve and National Guard and Reservists, when they come back, they're eligible for VA healthcare because they got called up by the President of the United States. Now, I get a lot of questions from people like yourself or some veterans who say, well, wait a minute. My son got called up by Governor Christie for the Hurricane Sandy. That's not a federal disaster. That's a statewide disaster. So they're not eligible for VA health care. You got to get called up for a federal disaster. Post office strike in 1970-71, believe it or not. If you were in the National Guard Reserves, you got called up for the postal strike, you're eligible for VA health care benefits. Somalia, Grenada, places like that. Okay? So and for those of you who don't, again, so you don't understand, active duty is mean when you go away, and like my father, he did 2.5 years. He left, he didn't come back for 2.5 years. I had an uncle, did 37 years in the National Guard. He wasn't eligible for VA healthcare benefits. He never did active duty, and his unit never got called up for a federal conflict. He gave up 37 years of his life to the country, basically National Guard reservist. One weekend a month you go away for training, and then 2 weeks in the summer you go away also. But you have a job, your regular job while you're home. My uncle happened to work for the post office. But he was not eligible for any type of benefits because he never got called up. The question is, does the VA supply things like wheelchairs and motorized wheelchairs? And answer is yes. Yeah, even if it's not service connected. Again, I get back to this. Are you seeing a primary care provider at the VA? Have you seen that primary care provider in the last year? And if you say something to that primary care provider, I'm having trouble walking, they'll do a consult to what is known as PM&RS, Physical Medicine and Rehab Service. Our Physical Medicine Rehab Service Department will evaluate you for a cane, a wheelchair, a motorized wheelchair. They'll do it all, and there's no charge for it. There's charge for the visit, but nothing for the apparatus itself.
Right.
But again, if you haven't seen a VA doctor in 5 years and you call up our VA doctor and said, you know what, I think I need a wheelchair. I haven't seen you in 5 years, Mrs. So-and-so. I'm not going to put the consult in for you.
And Frank, they'll also supply ramps and
Oh,
lifts. If they've been seen and they're being treated by a primary care physician and the veteran's in a wheelchair and you have no way to get them in and out of the house, they send it, actually it's odd, they send the prescription to the prosthesis department and then they send it out to bid and they will bill the ramp.
Thank you very much, you guys.